in the Department of Shalakya Tantra. Dr. Sri Kumar sir graduated from Government Ayurveda College Tripunithura and did his MS in Shalakya Tantra from IPGT and RA in Jamnagar. He received the first rank and gold medal for MS Shalakya Tantra, Shiro Nasa Karna Evam Kandaroga from Gujarat Ayurveda University, Jamnagar, and was also the recipient of National Ayurveda Scholar Award for PhD in 2011. Sir has also received the Dabur Ayurveda Award in 1998 and 99 and 2000, 2001 for first rank in the second and third profit BAMS exams. Sir has also received Nagarjuna Research Foundation Award in 2000 and is a recognized PhD guide under Kerala University of Health Sciences. So, on behalf of Team CME, I invite you to conduct this session, sir, and thank you for joining us today.
Okay, thank you, Dr. Namita. I think I'm audible, isn't it?
Yes, sir.
Okay, so thank you for the team CME for giving me an opportunity to speak in the Shirakapala Rogas. So as we know, Shirakapala Rogas, a few of them are very commonly presenting in the OPD. So I will focus on this that diseases and its management in this presentation. So before starting the Shirakapala Rogas, I think it is essential to know the anatomy of the scalp. Because of the peculiar anatomical features, most of the diseases are manifesting in the scalp having similar pathogenesis of skin diseases. As we know, the dandruff or the seborrheic dermatitis, like all these diseases are manifesting in the scalp because of its anatomical peculiarities. So the scalp means, I will cover the anatomy. So this scalp means it is a soft tissue covering the cranial vault, which the extent means it is extending from anterior to the posterior and to both sides. So anteriorly it will start in the superior orbital margin, and posteriorly it will end in the superior temporal line. On each side it will end up in the superior temporal lines, and posteriorly it will extend to the occipital protuberance and superior nuchal line. So this is the extent of scalp that we have discussed. It will start from the superior orbital margin and end up with the occipital protuberance and sideways to the temporal lines. So it is having 5 layers, as it the name indicate SCALP. It has 5 layers, that is skin, connective tissue, aponeurosis, loose areolar tissue, and periosteum. So this is the peculiar covering of the cranial vault, naming this scalp. So the structure of scalp means it has 5 layers. 5 layers means the first layer is the skin. So the skin diseases can also manifest in the scalp. And the superficial fascia or dense connective tissue. This dense connective tissue having a very good nerve supply, and the epicranial aponeurosis, and it is the gallia aponeurotica. So this gallia aponeurotica is responsible for moving the scalp skin in the cranial vault. That is a voluntary movement that we can perform, and then it is a loose connective tissue and pericranium, in which these 3 layers, that is skin, superficial fascia, and aponeurosis, are termed as the scalp proper, because the skin is very thick, hairy, and having rich sebaceous glands. It is adherent to gallia aponeurotica. So this thick, hairy nature with numerous sebaceous glands are responsible for the various diseases like arukshika and the dandruff. Like all these diseases are mainly due to the thick, hairy nature of the scalp. And the superficial fascia, it is a connective tissue, provides the proper medium for passage of the vessels, nerves, and the skin. As we know, the scalp having a very rich blood supply, nerve supply. So I think it is have a high role. Means the Murtha Taila, that is Abhyanga, Seka, Pichu, and Vasti, all these having a very good media to act through this superficial fascia, and it can be easily absorbed to this layer. And aponeurosis, it is the freely movable on the pericrania. So this is the scalp, means it is the extent from superior orbital margin to the occipital protuberance through two muscles. The anterior muscle, it is the frontalis muscle, and the posterior muscle is the occipitalis muscle. So the scalp is connected with the two muscles, that is anteriorly frontalis and posteriorly the occipitalis. So this anterior and posterior belly are connected with the gallia, and these two muscles are supplied with the facial nerve. So in the facial palsy, the frontal wrinkling will not be happen because the frontalis muscle will be paralyzed. And this is the arterial and nerve supply. So this is very essential to know the rich blood supply of the cranial vault. As we know, when there is some very little injury will happen in the scalp, then profuse bleeding will happen. So this is a rule of 5 for nerve supply. So total scalp is supplied with 20 nerves. 20 nerve means if we are dividing the scalp into 4 quadrants, each quadrant supplies with 5 nerve. That is supratrochlear, supraorbital, zygomaticotemporal, and auriculotemporal. That is dorsal nerve, and the motor branch of the temporal motor branch is by the temporal branch of facial, and the posterior part by the great gan, lon, gon, and ton. That is a short name. That is a greater auricular, lesser occipital, greater occipital, and a third occipital. So the scalp having a very rich nerve supply. So this nerve supply is responsible for severe pain. When there is an injury in the scalp, there will be severe pain due to this rich nerve supply. And as we have discussed, if there is a minute injury will happen in the scalp, then the bleeding will be profuse. So the particular characteristic, you can see there is a rule of 5 for arterial supply. This is supratrochlear artery, supraorbital artery, superficial temporal artery, posterior auricular artery, and occipital artery. So this is having an internal and external carotid anastomosis happening here, and you can see this anastomosis is just like the network of the vessels. So if there is any injury in the scalp occurs, then the artery will bleed from the either sides, means both the sides of the artery will bleed. So it is responsible for the massive hemorrhage when there is an injury of the scalp occurs. And again, it is having the rule of 5 for venous drainage. That is supratrochlear, supraorbital, superficial temporal, posterior auricular, and occipital vein. These 5 vessels are, means venous drainage is through these 5 veins. So the scalp having a rich nerve supply and rich blood supply through the arteries. So the drugs which is applied on the scalp area is having a high chance of absorption through the blood vessels as well as the nerve endings. So this holds the importance of Murtha Taila in local as well as the systemic diseases. And the lymphatic drainage, it is very essential to know the lymphatic drainage of the scalp. And anteriorly from the line, you can see one line is cross lining from ear to ear, and the area in front of that line is draining to the preauricular or parotid glands, and the area behind that line draining to the posterior auricular nodes and occipital nodes. So when there is a scalp inflammation, or there is some dandruff, or like that any pathology will manifest in the scalp, then high chance, or then the lymphadenopathy can be seen in the preauricular lymphadenopathy or the posterior auricular nodes or occipital nodes will be enlarged. So if to confirm the pathology like the dandruff or skin inflammations in the scalp, we can confirm by the lymphadenopathy, which is commonly occurring the preauricular lymphadenopathy or posterior auricular lymphadenopathy. So this drainage, this lymphatic drainage is responsible for the enlargement of auricular lymph nodes associated with the dandruff and other scalp pathology. So in some diseases, the recurrent lymphadenopathy which is happening in a child is highly suspicious of the dandruff and skin inflammations in the scalp. So while we are moving to the applied anatomy, So I would like to share these facts. That is, a black eye means if some sort of injury will happening in the anterior part of the scalp, then the blood collection will happens in the eyelids, because uh, the blood that will seep from the part to the auricular area, because this frontalis muscle is not having any bony origin. So the frontalis muscle, which is take origin from the upper eyelid, and it has no bony attachment. So the blood which is collecting below the frontalis muscle will seep easily to the upper eyelid, and it will be collected in that area, and the scalp lacerations will be highly painful, and sebaceous cyst can be easily happen in the scalp because of numerous sebaceous glands. And gapping wounds, that means if there is a cross injury happens in the scalp, then the frontalis muscle pull the scalp anteriorly and occipitalis muscle posteriorly, and there is a huge gap will form in between the wound. And the cephal hematoma, which is we will discuss it. And the safety valve, because I think no need to go for the details. So this is the one which is commonly presenting in the OPD, that is black eye. Black eye mainly occurs in the blow to the skull and a collection of blood in the upper neurotic space, producing generalized swelling affecting the whole dome of the skull. So blood slowly gravitates into the eyelids because of the frontalis has no bony attachments. So it is essential to know that if there is a scalp injury will happen due to fall or some injury, then the collection of blood will not happen in the scalp. The collection of the blood will collect around the eyelids or in the upper eyelid, and it is termed as the black eye or raccoon eye. So this is the diagrammatic representation of the raccoon eye. The blood will easily sweep towards the upper eyelid because the frontalis muscle takes origin from the skin, not from the bone. So these are the some scalp problems, that is dandruff, seborrheic dermatitis, candle cap, head lice, ringworm, folliculitis, psoriasis, lichen planus. So it is essential to know that all the skin diseases that will also affect the skin of the scalp because of its particular features, and some diseases which is manifesting the scalp will show greater clinical features when compared to the other part of the body, because the scalp having thick hair and numerous sebaceous glands. So these are the Shirakapala Rogas which is mentioned in Ayurvedic classics, that is Subashirshaka, Arumshika, Darunaka, Indralupta, Khaladi, Palita, Pitaka, Arbuda, and Vitriti, in which the common clinical presentations which is happening in the OPD is the Darunaka, Indralupta, Khaladi, and Palita. But we will just touch on the each and every diseases for the information. Actually, first is the Upashirshakam. Upashirshaka, it is mentioned as the caput. It is nothing but it is a caput succedaneum or subgaleal hematoma or subgaleal hemorrhage, which is commonly occurring during the birth time. That means during the birth injury or due to some pressure, excessive pressure during the time of labor will leads to the presentation of this Upashirshaka. In Ayurveda, it is mentioned that Kapale Pavane Dushte Garbhasthasya Vichayade Savarno Niruja Shofa, means Savarno Niruja means it is having the same color of the skin. That means it is a non-inflammatory presentation, and it is a shofa, it is an edema, and it is due to the Vata Kopa. It is essential to know that it is the Vata, the condition is due to the Vata Kopa, but it is manifesting as the Shofa. So in the Shofa Samprapti, there is a role of Vata dosha is there because of the Vata Vaigunya happening due to the Srododushti. So this is the caput. You can see the collection of the fluid between the galea, and there is some enlargement of the skin of the child, which is termed as the caput succedaneum. And you can see when we are going through the three types of swelling in the newborn. We can see there is an edema collection that is termed as the caput succedaneum due to the increased pressure during the labor, and some that is increased pressure may leads to some sort of subgaleal hemorrhage. So this subgaleal hemorrhage will also have take the shape of the upashirsha, and the cephal hematoma. The cephal hematoma is also having this type of enlargement, but the cephal hematoma will be limited in the suture line. So the cephal hematoma will not attain a larger size. So the caput succedaneum or the upashirshaka is nothing but either it is a caput succedaneum or it is a subgaleal hemorrhage. So both will happen due to the increased pressure during the time of labor. And the treatment, it is mentioned that nave the janmottare jade yojid upashirshake vadavyadhi kriya. The Vadavyadhi Kriya means if it is get inflamed, then it should be drained. Otherwise, it is a natural cause, it will be subsided as its own. So it is Vadavyadhi Kriya is the management. So when during the Bala Upacharaniya, the first sloga itself, Acharya mentioned that Bala Vishodhyudbad Abhyanga with Balataila. So Abhyanga with Balataila is the first line of approach of a newborn. It is because of the pressure massage with the thaila can easily cure the collected edema, because this edema is developed due to the pressure effect due to the Vada dosha. So we can easily manage that condition with a soft massage with Balataila. So it is Abhyanga with Balataila. I think it is practicing in all the homes, because the mother is well aware that when the child is born, there is some enlargement in the occipital part of the scalp will happen. It is nothing but it is edema, and the scalp, it is the enlargement is not due to the bone, it is only due to the collection of the blood or due to the serous fluid. So it can be easily managed with the smooth massaging. So it is mentioned that the Balataila with Abhyanga with the Balataila is the easy method to cure that condition. The next condition is the Arungshika. Arungshika, it is mentioned that Kapale, Kleda Bahula, Pittas, Kleshma Jandubi, Kangu Siddharthaka Nipa Pitaka. So Kangu Siddharthaka Nipa Pitaka means it is a small pitaka, that is the size of mustard or millet. And it is with the Kleda Bahula, it is having discharge, and Kandu Kleda Daharti, then it's itching, burning, and pain, and Bahuvaktrani, multiple pustules. So the as we have discussed in the anatomy, scalp having a numerous sebaceous glands, and if these sebaceous glands get inflamed, then it will show the features of this Arungshika. So it is due to the Pitta, Asrit, Sleshma, and Jentu. That means maybe infective origin or due to inflammatory in origin. And the dosha is the Pitta, Asrika, Pitta, Rekta, and Kapha. Kapha having great role because of its thick exudation. So this condition is modern is mentioned as it is acne necrotica miliaris. So it is millet, shaped like millet. So it refers to an inflammation of the hair follicle, is termed as the acne, and the necrotica means it is the inflammation that severe that it kills the affected hair follicle, and miliaris means it is the resemblance of the millet. So this is the condition. This is the millet, as you can see in the slide. It is a very Kangu Siddhartha. Kangu means it is the millet. So the presentation you can see in the slide, in the scalp, it is severe, numerous sebaceous glands, and if it is get inflamed, then it will leads to the pustule, small pustular like pitaka. It is the Arungshika. So this Arungshika, in the treatment, it is mentioned that Arungshika Jalagobi Hridasra means if it is recurrent and chronic, Jaloga is a very good option. And Hridasra, Nimbavarina Sikta means it should be washed with Nimba Patra Swarasa. So that yogas which is mentioned in the Kushta Chikilsa means actually it is a skin disease. It is manifesting very badly in the scalp due to the abundant number of sebaceous glands. So the Kushta Chikilsa can be adopted here. That means we can do the Siddharthaka yoga for the wash or Nimba Patra Sarasa for wash, and then Prabhuda Levana, then it should be followed with the Levana. Just like the Kushta Chikitsa, it should be followed by the Levana, and Padola Nimba Patra Irva Saharidre Sukalkide means Haridra or Padola Patra can be applied with the form of Kalka and Gomutra Jirna Pinyaga, Krikavagu Mahaledevi. So all this, so the management of the Ayurshika is first by the Rektamoksha with the Jaloga, then followed by the Nimba Patra, the Jala Sejanam, that is wash, and the Lebanam with the Padola, Nimba, Patra plus Haridras Kalka. And the yoga which is mentioned here is the Malatyadi, means Maladi Chitraga Shokana Natra Mala Prasadidam, Chacha Arungshayo Stylam Abhyangak Shurakristego. Means if it is chronic and the after the huge or the acute inflammation is subsided, if the skin shows some problems, then we can apply the Malatyadi Thailam. So it should be applied after removing the hair follicles. And Acharya again mentioned that if it is not subsided, then the Vamana is the treatment option. So this is the second disease mentioned in the Ayurveda. It is the Ayurshika. It is the Necrotica miliaris, which should be managed with the line of approach of the Kushtaroga Chikitsa. That means wash the area, apply the Kalka, and if it is not responding, then do the Vamana. Next disease is the Dhananaga. It is one of the most commonly presenting disease in the OPD. And Acharya mentioned that Kandu Kesha Shudi Swapa Raukshagrit Sfudanam Tocha Susukshma Kafavadabhyam Vidya Dharanaka. So Dharanaka means it is Kandu, it is having severe itching. Then Kesha Chudi, that means hair fall, and Raukshagrit Sfudanam Tocha, that means dry scalp and flaking of skin. And Acharya Susruta commentary, it is mentioned that Padhalabhasam Sarujaskam Shirastoji means the loss of the scalp skin or the desquamation of the scalp skin in or the excessive shedding of the dead skin from the scalp and Padhalabhasam, the layery like shedding of the dead skin from the scalp, and it is non-inflammatory. That means it is Kafavadabhyam. There is no Pitta Rekta. As it is described in the Ayurshika, it is inflammatory because it is having Pitta Rekta. But here it is a Kafavadam. There is not any inflammation. It is just shedding out the outer layer of the skin from the scalp. So it is clearly mentioned in modern, and it is the Psoriasis capitis. It is a condition of excessive shedding of the dead skin from the scalp. It is the Dharanaka, and when we analyze the Dharanaka, it is having itching, hair fall, dry scalp with the flaking of skin, excessive shedding of the dead skin from the scalp, and it is a non-inflammatory. And then in the treatment, it is mentioned that Vidyed Siram Dharanake Laladiam means Siram Moksha, means most of the diseases manifesting in the scalp, Acharya mentioned Siram Moksha because of the same or similar pathology of the Kushtaroga can be adopted here, because it is the scalp skin is nothing but it is having some sort of modified skin from the body. So the skin disease is there, then we are most commonly we are approaching the Kushtaroga Chikitsa, and Rekta Moksha having a great role. So in most of the diseases, Acharya mentioned the Rekta Moksha while managing in the scalp diseases, and Navana Murthavasti. That means it is a dry scaling out of the skin. So the Vasti is an essential or good treatment for managing this condition. And Acharya again mentioned that Kora Dosha Trinakshara Vadi Prakshalanam Hitam means while the skin is shedding out, we have to clear that shedded dead skin by the Kora Dosha Trinakshara means any type of application with the Kshalana property. Either we can use the lemon juice or we can use any type of Kshara which is diluted in the water and can be used for washing the hairs for removal of the dead skin. And the condition which is mentioned in modern, the same, nothing but the same condition, it is the dandruff and it is the Psoriasis capitis. So it is a general condition of excessive shedding of dead skin from the scalp. Acharya mentioned Sarujaskam, Padalabhasam, Tok is shedding out, and it is a non-infectious disease of the scalp. It is a Kapha predominant condition, and dandruff involves itching, flaking of skin, and without inflammation, and the scales are light white to yellow and dispersed without erythema. Without erythema means there is no sign of inflammation can be seen. And the another condition which is mimicking the dandruff is the seborrheic dermatitis. It is a disease that affects seborrheic areas of the body, scalp, face, retroauricular areas, and upper chest. Means it is a generalized local manifestation of the generalized dermatitis, seborrheic dermatitis, which can also manifest in the scalp. It is involves the itchy and flaking of the scaling skin, then neither contagious, not fatal, and seborrheic dermatitis has a seasonal pattern, presenting more frequently during the winter and improving during the summer, and sleep deprivation, stress are also aggravate the seborrheic dermatitis. So while explaining this Shirakapala Rogas, Acharya Susruta not included this Shirakapala Rogas in the Shiroroga Pratisheda or Shiroroga Vijnaniya. Acharya Susruta mentioned these diseases in the Shudra Roga Prakarana. So it is because that the Shudra Roga means it will not be a fatal condition. So all these conditions will not be a dangerous or life-threatening conditions in the patients. So all these group are mentioned by Acharya Susruta in the Shudra Roga. So while we are describing all these diseases, none of these diseases are fatal. So for example, in seborrheic dermatitis is clearly mentioned in modern science, it is neither contagious or fatal. And the sleep deprivation, stress also aggravate the seborrheic dermatitis. So as we discussed, the samprapti of the Shirakapala Roga having a similar samprapti of the Kushta Roga. So Kushta Roga samprapti means having high vitiation of the rasa and the recta. So in the rasa dhatu, the rasa vaha srodo dushti karana, Acharya clearly mentioned that chindyanam chadi chintanat, or the sleep deprivation, or the tension or stress that will aggravate many of the scalp diseases like the hair fall or the dandruff or the dermatitis. Every conditions that is actually it is a psychosomatic, means mental factors having a high influences of over the scalp diseases, especially the hair fall. So the rasa recta vitiation is a very crucial factor while we are taking the case. In the treatment, Acharya first mentioned the Siravida Tilalada, the Mrja Shilana. Mrja Shilana means actually in the Shiroroga Nidana itself, Acharya mentioned that if not taking proper bath, or Mrja Varjanam is the Nidana of Shiroroga, means if the patient is not taking proper bath, then it is the means proper bath means actually the skin layer is usually commonly it is shedding out. So we have to clean that area. The Mrja Shilanam, to keep proper hygiene of the scalp. Then Nasya Murthavasti. Murthavasti means actually when we are going through the details of this Dharanaka, it is having either Vata predominant or Kapha predominant presentation. Vata predominant means it will be very dry scaling. So in that condition, Murthavasti is a very good treatment. And in some conditions, there will be some sticky nature and some discharges from the scalp area. So it is having Kapha predominant. In that condition, Nasya followed by the Murthavasti is a very good approach. And Lebana means the conditions which is mentioned in the Kushtaroga, similar samprapti like the Sithma Chikilsa, that Lebana that we can apply on the scalp area, and Prakshalana with the Kora Dosha Trinakshara, that is for cleaning. So clean the area, follow the proper hygiene, and if necessary, then advise the Murthavasti or Nasya. So these are the common diseases which is presenting in the OPD. And the next group of diseases, all the conditions are related to the hair growth cycles. So before going to the Indralupta, Khalitya, and Indralupta and Khalitya, it is essential to know the hair growth cycle. So the hair length depend upon the length of anagen. So actually the hair is having three phases: anagen, catagen, and telogen. So this anagen phase is the growing phase. So in the growing stage means the hair length is depend upon the anagen phase. So the prolonged the anagen phase, the lengthier the hair. So the scalp hair has the longest phase of anagen. That means it has 3 to 7 years. And the eyebrows having the shortest anagen. So we can see the eyebrows will not be so much lengthier. It has a very short anagen phase. So it is a very short hairs in the eyebrows. And the scalp hair grows at 1 centimeter per month or 0.34 millimeter per day. That means 16 centimeter per year, having the scalp hair. So this is a peculiar feature of the scalp hair. So the anagen phase is the longest anagen phase is for the scalp hairs. No other hair in the body will get lengthier as like that of scalp hair. So these are the three phases of the hair growth cycle. It is essential to know the anagen, catagen, and telogen phase. So the anagen phase, again, I will repeat, the growing phase and the longest phase having 3 to 7 years. Length of this phase is determined by the genetics. So the genetic factor plays a major role, the length of the anagen phase. The root hair is embedded in the deep in the dermis and subcutis. So in the anagen phase, the hair is very strong. So it is very thickly embedded or deeply embedded in the scalp, and it has large and has pigments. And 80 to 90, it is very essential to know, 80 to 90% of the scalp hair is in this phase at any given time. So when we take the growing phase of the scalp hair at any time, 80 to 90% of the scalp hair will be of this anagen phase. So the catagen phase is the next phase in which the regression, so the growth phase is over. So this catagen phase is the regression phase, and the hair doesn't grow and it moves closer towards the epidermis. That means the deep embedded nature is lost and the root will move closer towards the epidermis and cutting and shedding from the blood supply. Thus, that means that in the catagen phase, the hair starts losing from the scalp, and it about 2 to 3 weeks and 1 to 2% of the all hair in the scalp. So 1 to 2% of all hair in the scalp is in the catagen phase. And last is the telogen phase. Telogen phase is the resting phase, and the hair can now be considered as dead. It is the dead hair phase, and it will fall out and get smaller and lighter, moves towards the epidermis and pushed out by the new hair growth. So when the hair becomes in the telogen phase, then the anagen phase starts. So that anagen, new hair, will push out the telogen phase hair and new hair growth will happen. So it lasts for 3 months and 10 to 15% of the hairs in the scalp. So maximum hairs in the scalp in the anagen phase, and the telogen phase, that means 10 to 15% is going to be dyed and shedded out in the scalp. So the scalp loses 100 to 150 telogen hair per day, which is only a small percentage of the total hair in this phase, and it is considered as the normal hair fall. So 100 to 150 telogen hair can be shedded out per day, but that should be replaced by the anagen phase. So the new hair should come and it should replace the telogen. So this is the growth cycle that we have discussed: the anagen phase, catagen phase, telogen phase. And telogen phase means it is the dead phase and the hair will shed out. So telogen phase, the exogen and early anagen. So the telogen phase means it is again a term that is the exogen phase. That means hair will fall out and it will be replaced with the new hair, and it is the early anagen will starts. So this growth cycle, as we know, when the patient is taking chemotherapy, the whole hair will be lost. This is because this chemotherapy, the chemotherapy means actually it will restrict or it will destroy the multiplication of the cells all over the body. So the multiplication phase is the anagen phase. So when the patient is taking the chemotherapy, then the anagen phase, that is multiplication phase, will be lost. So the all hairs will readily move to the exogen or telogen phase, and it will completely shut it out, and it will not be replaced by the anagen phase, because anagen phase is a growing phase and the chemotherapy drugs will not allow the tissues to multiply, which is the basic line of management of the cancer. So in chemotherapy, the whole hair will be lost. And when the chemotherapy will stops, then again the anagen phase will restart. And it having a lot of hormonal control. That means androgen having a great control over this great hair growth cycle. So the most important hormone is the androgen. So if the female is presenting with the maximum hair loss, then we have to see whether the androgen is elevated in the females. So the cause shorter this androgen will cause a shorter anagen time, then slower the growth in areas such as the scalp. So it will reduce the anagen time, and axillary and pubic hair respond to the testosterone. So this is the main response, that is androgen and testosterone will be responding to the axillary and the pubic hair. And DHT, derivatives of testosterone, that is the enemy of hair follicles in the head, and it will shrinks the hair follicles. And the estrogen has prolongs the anagen but decreases the growth rate, and responsible for the postpartum telogen effluvium. That means postpartum telogen effluvium means many of the hairs will suddenly move to the telogen phase and it will be shedded out. So there will be a huge hair fall during the postpartum period. And the thyroxine is also having a great role in the hair growth cycle. So advanced onset of the anagen and excesses can be stressful and leads to the telogen effluvium, and deficiency can also be same in addition to the slowing growth rate. So if a patient is presenting with the hair fall, it is essential to assess the thyroxine hormone in the body as well as the androgen in the body. So this is a normal hair pattern or normal pattern, which androgenic alopecia in males. So you can see the temple area will be going up, and then there will be a center gap, and the total scalp hair will be lost. So the hair loss is limited in the scalp area. So in the anatomy of the scalp, we have told that it is extending from the superior orbital margin to the occiput, and laterally it is limited to the temporal line. So the hair loss is maximum limited up to the temporal line. So this is the female pattern baldness. So female pattern baldness is not crowning, it is the thinning, or the scalp will be visible in the center part of the head. That is the center part of the scalp will be visible in female pattern baldness. Female pattern baldness means it is the androgenic alopecia in females. Due to the increased androgen level in the female, this hair loss is happening. This is a classical presentation of the androgenic alopecia in females. That is, the scalp becomes visible, the hairs becomes very scanty, and there will be huge hair loss mainly on the center part. In this condition, it is essential to know the androgen hormone in the body, and main reason for this is the genetic in nature. So the hair growth, as we have discussed, the hair has 3 phases. So to grow the hair, the anagen phase is required, and when it is start losing, then the telogen or effluvium may be suspected. So the first condition which is related to the hair fall in Ayurveda is the Indralupta. Indralupta in the Samprapti, Acharya mentioned that it is a Tridoshaja, but the hair loss, wherever in the body the hair loss happens, it is due to the Vata Pitta. Vata Pitta is always causing the hair loss. And in Indralupta, the hair loss is happened by the Romakupanugam Pittam Vadena Saha Murchidam Prachavendi. This is the common samprapti that is happening any part of the body where there is a hair fall. That means Pittam Vadena Saha Murchidam Prachavendi Romani. It will lose the hair. So if the Vata Pitta Kopa happening in the body, then the hair fall will happen. It is natural. But here the problem is that the kapha, that is the scalp skin, it is a very thick skin or very sebaceous rich area that will prevent the new hair growth. That means it will prevent the anagen phase. So once the hair is lost, the anagen hair should come from that area. It will be prevented by the coating nature of the kapha. So the main line of treatment is the prachana here or kuttanai here. So the Romakupa Runandhatsya Tena Manyesham Asambhavaha that is the interlupta. So the hair fall will happen due to the Vata Pitta Kopa. Here, the thickened skin or the presence of Sleshma in the scalp area will prevent the new hair growth. That means it will prevent the anagen hairs. So this is a Samprapti. So Vata Pitta, which is happening, or Vata Pitta Kopa in the Roma Kupa, it will cause the hair fall, and this hair fall is leading to the Samprapti in the scalp skin, that is Kapha, Rekta, Roma Kupa, Rodhanam, due to the Levana Swabhava, and it will prevent the new hair. So this is the Interlupta Samprapti. So the Interlupta is actually, it is the hair fall. Nothing but it is a hair fall. So it is, the hair fall means it is ranges from mild hair thinning to the total baldness. As we have discussed, there may be thinning or total loss of the hairs. So the interlupta and the Khalitya having the same Samprapti. Interlupta, the sudden hair fall in round patches, whereas in Khalitya, there is a gradual loss in a huge manner will happen. So the Samprapti is same. So this mainly occurs due to the side effects of the side effects of the drug, that is beta blockers, that is cardiac. If patient is taking the cardiac medicine or warfarin and the levodopa, all these having a side effect in the hair cycle, and as a symptom of medical illness, that is SLE, syphilis, thyroid dysfunction, deficiency of protein, iron, zinc, and calcium will also lead to the hair fall, and due to the tinea capitis, the local problem, and the telogen effluvium, that is a common form of hair loss, happens 2 to 3 months after major stress, prolonged illness, or major surgery or serious infection. So this is a common factor that we should know, that is telogen effluvium, as we have discussed. When a major stress happening in the body, that may be due to the stress during the labor, or due to the death of the close relatives, or due to some disease, due to that condition, the telogen, the anagen hairs suddenly moving to the telogen phase, and it will be completely shedding out. That is a fast manner. That is the loss of hairs in a fast manner is the classical feature of the telogen effluvium. So when we are taking the history, then we can see there is a major stress factor. So it is in the Ayurveda, in the Samprapti of the Interlupta, it is clearly mentioned that Roma Kupa Anukam Pittam Vadena Saha Murchidam Prachavendi. So where is Vata Pitta Kopa happens in the body, then the total loss of hairs will happen. So in the while taking the history, we should ensure about the history of the patient, about the history of a major stress or any major surgery or a major disease which has happened in the course of the disease. So telogen effluvium means after that stress, then the anagen phase will restart. So it is very easy, or it is a very promising condition in which the growth of the hairs will happen again. So in the treatment, Acharya mentioned in the Interlupta Chikitsa, Siravetha, Prachana, Lepana, and application of the Hastidantamashi. So the Siravetha and Prachana is mainly because the Kapha dosha is preventing the new hairs, so the anagen hairs to come out. So that area, the hair follicle should be stimulated by the Prachana here. So the Siravetha, as we have discussed earlier, all type of scalp diseases having the same Samprapti of the Kushtaroga. So the Rakta Moksha is the prime line of management in any type of the scalp diseases. But here that particular or the specific treatment is the Prachana, and followed by the Ruksha Lepana. That means in the treatment is the Lagali Lepana. That means it is an Upavisha. And the Tura Patra Lepana, that means the Ruksha Lepana is advised to stimulate the hair follicles, and when the hair starts coming out, then the Hastidanta Mashi or Mesha Vishana Mashi is indicated. So the Mesha Vishana Mashi means when the new hair starts coming, it will be of gray in color. So to convert this gray colored hairs to the black colored hairs, the Mesha Vishana Mashi is indicated. And in the Samprapti of the Khalati, the same Samprapti of Interlupta is applicable. And it is mentioned as of 4 type. No need to go for that detail. And asadhya, and Acharya mentioned the asadhya lakshana of khaladi, that means nakhaprabha. So when we are observing the scalp, when it is having very shiny appearance, just like nail bud, it is very difficult to treat. And if it is associated with the burn scar, as we know, when there is a burn occurs in the body, then the hair will be lost and new hair will not come. And if it is devoid of hairs and with the burning sensation, that means with the burning sensation also, then the prognosis is very bad. So this khalati, which is and interlupta, which is typically correlated to the alopecia. Alopecia is defined as the loss of hair from areas where hair normally grows. So it is very much applicable to the scalp, because in scalp we are expecting hairs, that long anagen phase hairs we are expecting. So if the hair is lost in that area, it is nothing but it is alopecia. So the partial or complete loss of hair will happen in alopecia. So this alopecia, as per the manifestation, it is divided into 6 types. So it is alopecia areata. This alopecia areata is the circular pattern hair loss. It is the interlupta. And alopecia totalis. This alopecia totalis is the total loss of hairs in the scalp. It is the baldness. And alopecia universalis, and it can happen. The loss of hairs can happen in all over the body. Then it is termed as the alopecia universalis, which is for example, which is normally occurring in the chemotherapy time. And alopecia barbae is the loss of hairs in pattern in the from the beard. And androgenic alopecia, that is alopecia which is related, is strong relation with the androgen, that we have already discussed. And the cicatricial alopecia, in the asadhya lakshana of the khalida, Acharya mentioned that if it is a burn scar like, then it is asadhya. So this cicatricial alopecia means it is maybe this alopecia can happen associated with the scar, burn scar. So this is you can see it is a very common percentage is alopecia areata. Here the line of approach is the prachana followed by the tikshna lebana, and when the hair starts coming out, then apply the hastidanta mashi or mesha vishana mashi. And this is the alopecia totalis, means the total loss of hairs from the scalp. And you can see this is alopecia universalis, means the total loss of hairs, including the here you can see the eyebrows are not lost. So only the hair loss from the scalp. Is it alopecia totalis? And here you can see the eyebrows, eyelashes, and all axillary hairs. Everything is lost. This is the alopecia universalis. And so I think everyone has got some idea regarding the hair growth cycle and the disease which is related to the disturbance of the hair growth cycle, that is the interlupta and khalitya. And next condition is the palitya. Palitya means it is also a very huge problem in the present condition. Palitya, it is, as Acharya mentioned, it is that mentioned that shoka krodha Sramagradaha Shariroshma Shirogada Keshan Sadosha Pajati. That means the Sharira Ushma is responsible for the Palitya. So in Pitta Pragrati, Acharya Sharangadara, it is mentioned that Akala Palitam. That means the premature hair, graying of hairs that can happen in the Pitta Pragrati, that should be considered as the normal. And it is very difficult to treat. Means don't go for the treatment of the Pitta Pragrati because it is a natural. But if other than the Pitta Pragrati, if there is any Pitta happening due to Shoga, Srama, Krodhagrada, that we have already discussed, the Shoga, that is stress induced to have, the stress having a great impact on the hair fall as well as the graying of hairs. That is hair fall that we have discussed, that is the telogen effluvium. It is the stress induced hair loss. And in the Palida, it is nothing but the stress induced graying of hairs. And in Ayurveda, it is mentioned that it is of 5 types: Vadaja, Pittaja, Kafaja, Sannipadaja, and Shirorujodbhava. That means discolored and the Sparshasahata. Means some patients having a severe form of migraine also complains of this type of hair means graying of hairs. So this is the mainly the graying of hairs. That means actually the black colored hair turning to white. It is the palitam. So in the Samprapti, the Sannibadaja Khaladi and Palita, it is mentioned that asadhya and age related. It means Khaladi. If it is age related, then it can be considered as a Swabhavikavadi for especially Pitta Prakriti. And in the treatment line, the Murtha Taila, Nasya and Rasayana, because it is a age related or due to the Vata Pitta Kopa, then we have to adopt the Rasayana Chikitsa in the mainstream. So when we go through the modern part, that it is the canitis. Canitis is the graying of hairs. Graying of hairs means it is mainly genetically determined. Means if the patient is having a strong genetic factor, then it is very difficult to treat. Means the hair graying usually inherited in an autosomal dominant manner. And the graying of hairs is when cells at the hair base, that means melanocytes, stops producing the pigment which is responsible for giving the hair its color. So in the pathogenesis, it is mainly due to the inability of the hair cells to produce the melanin. So in human hair, there are two types of melanin is there, that is eumelanin and phenomelanin. The diversity of hair colors, you can see the hair color in the Indian people are different from European, Americans. And due to this diversity is mainly due to this amount of pigments in the hairs. So the diversity in hair color, quantity and ratio of black, brown, eumelanin, and reddish brown phenomelanin. So the eumelanin and phenomelanin is normally present in the hairs, and the amount will determine the color of the hair. So the grayish color or means brownish red color is mainly due to the presence of phenomelanin, and black color due to the eumelanin. So graying is usually develops at the temple and then spreads in frontal and then to the vertex and the parietal lobe, affecting the occipital region last. So if the patient is complaining of graying of hairs, if it is in the beginning stage, then it is usually develops in the temple and then spreads to the frontal and then vertex and then the parietal. In the process of canitis, that means it is an enzyme, especially the catalase, normally present in the hair follicle, break down the hydrogen peroxide into water and oxygen, protect from graying. So actually this process of canitis is nothing but bleaching. So the bleaching due to hydrogen peroxide is the main pathology of graying of hairs. So normally the enzyme catalase is present in the hair follicles. So if there is an accumulation of hydrogen peroxide occurs, that means hydrogen peroxide mainly occurs due to the application of hair color or application of shampoo or application of some chemicals in the hairs, it will leads to the accumulation of the hydrogen peroxide. But when the hydrogen peroxide is accumulates due to the normal circumstances, why due to the exposure to sunlight, exposure to dust or wind or like that, if there is a hydrogen peroxide is accumulated, then that hydrogen peroxide will be break down by the normally present catalase into water, and it will prevent the graying. So the catalase will act as a protective mechanism from the canitis. And in older age, hair follicle cannot produce proper amount of the catalase, that's a higher concentration of the hydrogen peroxide. So in the older age, as the hair starts weak, then the normal catalase cannot be produced in a normal quantity, so the hydrogen peroxide will accumulate and it will start bleaching the hair. And in high concentration of the hydrogen peroxide will attack the tyrosinase, an enzyme responsible for melanin production. So this hydrogen peroxide actually will attack the tyrosinase, which is responsible for the melanin production. So the accumulation of the hydrogen peroxide, which will destroy the triosinase, and it will again destroy the melanin production, and the hair starts bleached. So the Samprapti that we can explain from this slide. So the catalase is the normally present enzyme which will protect the hair from bleaching or from graying. So it will promote the breakdown of the hydrogen peroxide. So hydrogen peroxide accumulation will be destroyed by the catalase. So as age advances, the amount of catalase becomes reduced. So as the amount of the catalase is reduced, hydrogen peroxide will start accumulating, and the hydrogen peroxide is mainly produced from the scalp hair, mainly from the chemicals. So if a person will start again and again hair color, then high chance of graying of hairs will be there. And due to the exposure to the ultraviolet rays, or due to the diet, insufficient diet, and due to the stress. So stress is a factor which is actually producing the excessive hydrogen peroxide in the scalp. So reduced catalase or increased hydrogen peroxide will reduce the tyrosinase, and it will reduce the melanin production, and the cavities or graying of hairs will happen. So graying of, for the pathology of the graying of hairs, the two factors are responsible: either reduced catalase or increased hydrogen peroxide. So in some cases, even though there is a catalase is available in the sufficient quantity, due to the increased hydrogen peroxide, normally the hydrogen peroxide should be limited to a particular level. But if the hair means chemical application of the hair is increased, then the hydrogen peroxide will be increased, and that is the catalase is not sufficient to decompose the increased hydrogen peroxide, and again the cavities will happen. So this is the normal samprapti happening in the hair. And in Ayurvedic point of view, the increased hydrogen peroxide can be considered as the pitta kopa. That can be due to stress, means shoga, srama, krodha gradaha, or due to the chemicals, or due to the ultraviolet, or the pitta pradhana or pitta vitiating factors are responsible for the increased amount of hydrogen peroxide. So what is premature graying? That is, it is defined as the graying of hair before the age of 20 to 25 years in Asians, and before 30 years in African American population. So in African American population, the melanin pigments are different. So they're having a thick black color. But in Asians, it is due to the diversity, they can easily go to the premature graying, means within 25 years. But it is premature graying as a scientific explanation. If it is happening before the age of 25, it is definitely, it is a premature graying. But in practically up to the age of 35, that can be considered as a treatable graying of hairs. So the premature graying of hairs that we can conclude in this slide, that is the premature death of melanocytes, that we have discussed. Then the hereditary nature, then illness, that is vitiligo, then drugs, that is chloroquine, intake of chloroquine, then hormones, that is in neuroendocrine control, that is thyroid related hormone, then alcohol and smoking, oxidative stress, nutritional deficiency, vitamin deficiency, and low serum ferritin and low serum calcium and vitamin D3 levels. So when we go through the details, most of the factors, that is oxidative stress, alcohol and smoking, nutritional deficiency, all these having the Vata, Pitta, Kopa. So here the Brahmana therapy or Rasayana therapy, that is to reduce or to control the oxidative stress. The antioxidant therapy, that is nothing but the Rasayana Chikitsa, is ultimate Chikitsa for handling this type of premature graying of hairs. And low serum ferritin and low serum calcium and vitamin D3. So calcium and vitamin D3. That means in Ayurveda it is mentioned that the hairs are the Ubadhatu of Astidhatu. So if there is Astikshaya, then loss of hairs may happen, or the hair related issues or the graying of hairs may happen. So if the patient is presenting with the premature graying of hairs, it is essential to go for the serum ferritin level, then serum calcium level, and vitamin D3 level, then thyroid hormone level, and about the stress, means reduced sleep and reduced or improper diet. So reduced sleep or improper diet, both are having the Vata, Pitta, Kopa in the body, and it is responsible for, as per modern science, it is responsible for the accumulation of the hydrogen peroxide and bleaching of the hairs. So bleaching of the hairs in modern is termed as the Pachati in Ayurveda. So in the Ayurvedic approach means Asthidhatu. We are treating the case based on the Samprapti in the Asthidhatu. That means the Ubadhatu or Dhadumala of the Asti is the Kesha. So the Danda, Nakha, color. So when we go through the modern part, the Danda and the Nakha are the Ubadhatu of Asti. So in the keratin are is the base material of the hairs as well as in the nail. So both having the keratin, but in the keratin in the scalp is converted into hair, and melanin pigments will black that area. So chemically both are the keratin. In the Prakriti, the Pitta predominant, it is a gene mapping. It is proven that the Pitta Pradhana or Pitta Pradhana Prakriti having a strong familial or premature graying of the hairs will happen. And in the treatment, the Krishna Tila Rasayana is one of the best Rasayana mentioned for Astikshaya or Danda, improving the quality of Danda, and which is usually for the good hair. That means black hairs. And Shiro Abhyanga is also very good. Means as we have discussed, the hydrogen peroxide accumulation can be reduced by the proper Shiro Abhyanga. And the Rasayana, the antioxidant, so that we have already, the oxidative stress can be managed with the Rasayana Chikitsa, then yoga to reduce the stress, and exercise for the normal hormonal balance as well as the healthy practice, and avoid pitta vardaka ahara vihara, the adapa, acidic foods, amala, levana, rasa. So this amala and levana rasa, if you are taking an excessively, then there will be excessive accumulation of the hydrogen peroxide. And if applying of the chemicals on the scalp skin, then again accumulation of the hydrogen peroxide will happen. So this is the Ayurvedic approach for managing the Palita. And in the treatment, Acharya mentioned, that is Bhrangaraja Tailam, then Jivaniya Gana Siddha Nasyam, then Nimba Taila Nasya for 1 month, and should drink milk only. So the Nimba Taila Nasya. So Nimba Taila, if doing the Nasya for constantly for 1 month, and should take milk properly, then local application of Taila, all are important in the management. And the specific yoga, that is Tila Malagadi Leba, it is a specific yoga, very useful yoga, that is Tila Samalaga Panta Inchalko Madhuga Madhu Brumhed Renjayed Kesha. That means it will increase the quantity as well as it will give the natural color. Brumhed Renjayed Keshan Murtha Pralepanat, for the scalp area or the Talabodichil, we can apply for the Tila Malagadi yoga. And the Prapondirigadi Tailam, that is Prapondirika Madhuga, that yoga, Sanvar Murthagadan Handi Palidanicha Shilitam. That means Sarva, all the type of Palita can be managed with the Prapondirika Tailam for local application. So now we are moving to the end of the presentation. So these are the main medicines. So while we are discussing the management of the scalp diseases, majority of the medicines are for the local application. So the local application is very important, and the locally applied medicine having a high chance of absorption. For example, the application of Talam or the application of the Shiro Abhyanga for reduced sleep, all having a high absorption power due to the increased nerve supply or huge blood supply in the scalp, having a high chance of absorption. So in the Asana Villadi Tailam, so these are the medicines which is available in the market for the scalp management of the scalp diseases. Just I am going through the names only. I think most everyone will be familiar with the medicines. That is Asana Villadi Tailam, Asana Manjishtadi Tailam, then Asana Eladi Tailam, then Nishkalkanenna, which is the product of Vaidyaratma Aushatashala, which is especially mentioned for Shirashula. So in the Shirashula also, Shiro Abhyanga is important. And the Amrutagirana Menna, it is the product of SNA. It is also used for headache and cold. So when the improper application of the oil in the head may leads to the cold. That means the medicine which is applying on the scalp having a high absorption power. So single application can cause the problems. And hello. So the Bela Guluchadi Taila, then Bela Dhatradi Taila, then Bela Hadadi Taila, and Bela Ashwagandhadi Taila, that is which is especially used for the Kshayaja and Rektadushyam, then Brahmga Malagadi, then Amrdadi Tailam, the product of Kottakkal, a burning sensation of the head, and Bhujagaladadi Tailam, which is that this red marked is very useful for the dandruff, that is Bhujagaladadi, which is the product of Vaidyaratnam, which is useful in the dandruff and hair fall. Then Vaidyaratnam also it is available, that is used especially applicable for the hair fall, and the Himasagaram, Anidra. So I think with this presentation, you may be aware about why this application of the medicine over the scalp having an inducing the sleep due to the direct involvement of the 20 nerves. When we are applying the medicine over the scalp, then the 20 nerves are stimulated as on a sudden. And Chandanadi Tailam, Durvadi Kera Tailam, and Durdura Patradi, which is very commonly useful medicine for dandruff, and Ayyappa Kera Tailam, which is also useful in dandruff, which is the product of Kottakkal. Then the Sorset oil, a lot of skin oil, and Dharanaka Tailam, which is also the product of Vaidyaratnam. It is also having a useful in the Dharanakam and Indralupta. So I would like to conclude this presentation. So I think most of the diseases which is commonly presenting in the OPD that we have discussed in this presentation. So the scalp diseases are very important, and these diseases are mainly due to the peculiar features of the scalp. That means thick hair and thick hair follicles and numerous sebaceous glands are responsible for the many of the diseases. That means as the thick hair is there and the sebaceous glands are there, then there will be the production of the heat will be more, and the production of heat will cause the increased production of the hydrogen peroxide. So normally every hair, every scalp having a hydrogen peroxide in a limited quantity, and it will be decomposed. The accumulation of the hydrogen peroxide is also prevented by the catalase. So that will prevent the canities. So the peculiar features of the skin is mainly responsible for the most of the diseases. So the skin diseases approach can be taken in while managing the many of the scalp diseases. So the Kushtaroga Chikitsa, for example, the Jivantyadi Yamaka, application of the Jivantyadi Yamaka or Siddharthaka Snana, or the Nimba means Tiktaka Krida for the Snehavana, Arakuda Maha Tiktaka, Tiktaka, Padoladi, everything can be used for the management of the skin diseases which is manifesting in the scalp also. And the Murtha Daila, mainly the Abhyanga, Sega, and Pichu, having a great role. As for the anatomy, we have discussed the rich blood and nerve supply. So the medicine which is applying on the Murtha Daila, that means the Abhyanga can prevent the premature graying as well as the accumulation of the hydrogen peroxide or the dryness of the scalp hair. So it is a preventive. So it is mentioned in the Dinacharya itself as a preventive aspect. So in the preventive aspect, the Dinacharya, if we are following the Dinacharya means the Abhyanga is there, then the Pratimarshan Asya is there, or if we are properly following, no need to follow the everything in the Dinacharya. If we are applying the proper oil in the head, then majority of the disease can be prevented. And in the curative aspect, the Madhusnuhi Rasayanam is effective in the skin diseases which is manifesting in the scalp. And in the Rasayana Chikitsa, mainly the Atilam means Krishna Dila Rasayanam or Narasimha Rasayanam, like all these Rasayana Chikitsa or Brahma Rasayana, Chavana Prasham, everything is useful when there is oxidative damage occurs in the hairs. And in the mainly in the hair fall and canities, that is premature graying. Both these are happening mainly as a result of stress. So the stress induced condition can be managed with the Rasayana Chikitsa. So I think I have almost covered the scalp diseases, the approach of scalp diseases in Ayurvedic point of view, as well as how to manage the commonly presenting diseases from the OPD. I think so I would like to extend my sincere thanks to the team for giving me an opportunity to present the scalp diseases and its management. So thank you.
Thank you so much, sir. It was a very enlightening session, and I'm sure there will be some very nice discussions coming further. So let us move on to that. The first question, sir, can you please suggest some special diet for hair growth?
Actually, in my opinion, there is no need of special diet. The diet that a proper diet is necessary, means diet means the ahara. Ahara means the proper timely diet, timely sleep, time bath. So if you are taking bath in the afternoon, so then we know that there is a pitta goba is happening. In the pitta goba in Ayurveda, actually in the modern, it can be correlated with some sort of acidic material, mainly the hydrogen peroxide or chemicals accumulating in the scalp. So, and the oxidative stress, as we have discussed in the Samprapti of hair loss, the Vata Pitta Koba. So all the factors which is leading to the Vata Pitta Koba is highly dangerous to the hair health, so it should be avoided. So Vata Pitta Koba means actually it can be managed with a natural course. That means proper timely diet, Shiro Abhyanga, proper sleep, and a stressless life is essential. I think if we are following all these, there is no need of any special diet. And if we are concentrating on the special diet, then the hair growth, as per in the Ayurvedic classics, it is totally dependent upon the Astidhatu. So the Astidhatu management, that means the calcium and the vitamin D3. So when we are moving to the more Ayurvedic aspects, the Rasayana, mainly the Narasimha Rasana, or even the Kshira, intake of Kshira, or in some cases, the use of Shankhavasma, that can be added as a supplement only. It is not coming in the major treatment, it can be adopted as a supplement. So the acidic material should be avoided. So what are the things to be taken? More than that, what are the things to be avoided? It is more important. That means increased spice items, increased use of alcohol, smoking, all this. What are the things which is going to produce the oxidative damage to the body that should be avoided?
Thank you, sir. The next question, sir, can we use Narasimha Rasayana in females?
Why not? In some cases, in Narasimha Rasayana, means somebody is afraid of gray hair growth in unwanted places also. That will not happen. All that thing are genetically determined. If female is born, then that body is constituted as a female. The male pattern will not happen if you are giving the medicine. The medicine will not hamper or will not affect the natural genetic pattern. So if we are giving the Narasimha Rasana in females, there is no harm. That means it will promote the hair growth, and that hair growth is genetically determined, that the scalp hairs will be growing, and it will not means beard or most will not be highly promoted by the use of this medicine. So as a part of the medicine, there is no harm for prescribing the Narasimha Rasayana to females.
Thank you, sir. That question was from Dr. Sridevi. Now, the next question is from Dr. Neha. Sir, how to manage post-COVID hair falls?
Actually, I think everything means but we have already discussed here. So that is the telogen effluvium. So while we are going to the Samprapti of telogen effluvium, that is due to the hair fall which is happening 3 months later, the major stress. 3 months later, the major stress. So the major stress is the disease. So after the 3 months, we can expect a hair fall. So just give the supplement medicine, so the condition will be naturally correcting. So just support the natural course of the condition, so that will be normally it will be corrected. So in that condition, the stress induced factor is the main thing. So give the medicines and the Shiro Abhyanga, Pradimarshanasya and internal medicines which should be addressing on the stress, and just give an assurance to the patient that this is a normal phenomena and which will happen as an effect of the stress in the body or major illness in the body, and it will be corrected after 3 months. It will be manifesting, and after that it will gradually the anagen phase will restart, and this telogen phase will be over after the natural cause of the stress, and it will be regenerating. So in that condition, the management of the stress plus the Rasayana Chikitsa with the Pradimarshanasya and Shiro Abhyanga is very useful.
Thank you, sir. The next question. Sir, can taking bath under shower cause hair fall?
Actually, that is not a problem. If we are, as we have discussed, what are the things that we are going to apply in the scalp will decide the main fact. That means as we know, a lot of cosmetic things are available, and which is applicable or which is readily available from the market, ranging from less cost to very huge cost. So in that area, they are giving the chemicals which will help to glow the hair. Glowing the hair means it is washing the normal moisture. So that means it is chemical. All the things that we are applying on the scalp is chemical. So increased chemical application in the hair, that means it is the accumulation of the hydrogen peroxide, and we are going to bleach the hair. So in some beauty parlor, the bleaching is readily available. We can change the color of the hair. It is nothing but bleaching. So once we have started bleaching the hair, then it will naturally happen. Then there is no need to again bleach the hair. The hair will start bleaching as its own, but the bleaching will be of white color. So if we are starting to bleach the hair unnaturally, means naturally their bleaching will happen in the old age. That is due to the reduced tyrosinase in the hair, not due to the increased accumulation of hydrogen peroxide. So if you are applying a cosmetic or chemicals in the head, then that will start destroying the natural cause of the hair growth or hair cycle, and it will start destroying the hair. So once it start graying of hairs, then it is very difficult to cure. So the Acharyas clearly mentioned that it is very difficult to go for the Rasayana. Rasayana means it is a long course of treatment will be required for addressing that condition. So bathing under the shower is not a problem, but what are the things which are applying on the head is the main problem.
Thank you, sir. The next question. So how can we manage a condition of oily, greasy scalp with dry, thin hair?
Actually, oily, greasy scalp. So thin hair. So in that condition, the pathology is the scalp. Means the hair is growing from the scalp skin. So actually, this is due to the scalp skin issue. In the Dharanaka, as we have discussed, so Sukshmam, either Kandu Keshachuti, means itching will be there, falling of hairs will be there, and scales will be there. So Kapha Vadhabhyam, that means Kapha and Vada. So if it is Kapha predominant, then it will be oily skin. So in that oily skin, first clean the area, Kora Dosha Tranaksharavadi, means with some cleaning material, natural cleansing material, wash and clean the oily skin, and then apply the Murtha Pralepana or Murtha Ranjaka or Murtha Kesha Vardhaka Taila. Kesha Vardhaka Taila means mainly after cleaning the scalp skin apply the oil for which will promote the hair growth is very good. And if this thin hair means if it is not properly coming out, then we have to think about the Indralupta Samprapti, and Kuttana should be advised in that condition. So actually the thinning of hairs may be due to the genetic factor as well as the androgen. If it is happening in young females, then we have to suspect the androgenic or pattern hair loss in the female. So just go for the thyroid checkup, androgen hormone level, family history, and for as a local treatment, just complete the or avoid the that moist skin and promote the growth by applying the oil. And if it is not resolving, then the Acharya again mentioned that Vamana is this skin, the scalp skin is having some other importance also. That skin is placed on the Kafasthana. So there is a maximum problem related to the Rasa Dhatu also will be there. So the Rasa and Rekta, whereas in the peripheral part, Rekta predominant, Rekta Dusha will suddenly manifesting on the skin disease, whereas the accumulation of the waste material as well as the oily thin sebaceous gland secretion will affect the hair or the health of the scalp skin. So Vamana is another choice to treat that condition.
Thank you, sir. That question was from Dr. Rutuja Patil. Now the next question from Dr. Taj. Sir, can hot water bath damage hair follicles?
Yes, definitely. Means in Ayurveda, it is mentioned that Tena Tuttamangase means Ushnambuna Adakayam Belahurt. And Tena Tuttamangase, that means when we are taking bath of the head, then Belahurt Kesha Chakshusham. It is very causing damage to the Kesha and the Chakshu. Kesha and Chakshu both having the Pitta predominant organ, means the Pitta vitiation. That means if we are taking a hot water bath, then we are indirectly causing a Pitta Kopa. Pitta Kopa means it will damage, means the total health of the hair is depend upon the Pitta. That means Pitta, it is nothing but Resurrecta. Means the as an Asrayi Bandha, Pitta is having a total relation with Rekta Dhatu, and this Rekta Dhatu is totally dependent upon the Rasa Dhatu. Means the Rasa Dhatu get Renchakatva and it is converted to Pitta. So to Rekta. So the Rekta will possess the properties of Rasa and Rekta, and this Pitta Kopa means it is damaging the Rasa Rekta Dhatu vitiation. So if we are taking the hot bath, means one should understand that the taking hot water bath for a single day or couple of days is not going to damage the hair. As a habit, when we are doing this as a habit, then it will naturally damage the hair root follicles. The hair root will be damaged. So as we have discussed, the scalp hair is having a great anagen phase, and the great anagen phase having the embedded hair root in the skin. The deeply embedded hair follicle will start damaging and it will go easily shut it out. So the normal anagen phase will be shortened due to the hot water application continuously in the scalp hairs, so that will lead to the hair fall.
Thank you so much, sir. The next question is from Dr. Neha. So how to manage hair fall in case of early menopause?
Early menopause, I think that also we have discussed all the hair fall. Means the hair fall is totally dependent upon the hormonal changes in the body. So the menopause means it is very much stress related condition. So this stress is going to create the problem in the hairs. So the main fact this it is a natural cause. It is very much difficult to treat that condition. So we can take some preventive aspect in that condition. If we are suspecting the menopause or there will be signs and symptoms of the menopause, then it is better to start the blood hemoglobin level in a proper way. That means give start the Lohasava or the medicines which will promote or Mandura Vadaga, like that we promote the serum ferritin level, and the osteoporosis is also happening in the menopause age. So just treat the or concentrate on the blood hemoglobin level and blood calcium level, so that I think we can somewhat we are approaching towards the management of the hair fall, and just try to reduce the stress as well as for the stress phenomena we can advise the yoga techniques. It is a very good stress reducing technique, and as well as the Shiro Abhyanga. So the mental factors means when we are when the patient is going to the menopause, there will be mental stress, that what may be the attitude of the husband or what may be the attitude of the others too, like that a lot of stress is happening in the body. If we are able to reduce the stress and give the iron and calcium supplement in the form of medicine and the Shiro Abhyanga, I think it is better.
Thank you, sir. There are a few more questions. I hope we can continue.
Okay.
The next question is from Dr. Neha. So please suggest some best hair oil for adults and kids.
Actually, hair oil means again we are moving to the chemicals. So in Shiro Abhyanga, I think there is means they are, if they are converting the hair oil, means actually the medicines which is prescribed, that the hair oil that if the best medicine that we should prepare and give to the patient, otherwise it becomes very means the preparation method is also very important. So if the preparation is not proper, and if they are starting a new head oil, then the child or the patient will start sneezing. So that means single application of the medicine over the scalp will affect the general circulation. So the best hair oil, that means the Shiro Abhyanga Taila. In Ayurveda, it should be mentioned as the Shiro Abhyanga Taila. As per the purpose, I think in the last slide we have discussed a lot of Taila, a lot of Taila which are applicable or which are available in the market. So as per the purpose of the patient, we can advise. So if a patient is having very much hair fall and having some ear or eye or nose related, means patient with hair fall which is highly allergic, then we have to choose the Asana Vilwadi. It is a very good medicine. And if the patient is having a reduced sleep and hair fall, then we can use the Chandanadi or Prabondirigadi Kera. And if the patient is having very dandruff related hair fall, then Durdura Patradi or Malatyadi. Like that, the hair fall that we have discussed, the hair fall will not happen as a single entity. It should be associated with some other systemic, or due to some mental related, or due to some other sense organ related factors. So accordingly, we have to select the medicine. And if most of the conditions, the problem of hair fall is related to the dandruff. So first, don't prescribe the oil because it is a kapha predominant. So after the reducing the kapha accumulation in the scalp, then we have to give the medicine. That means the hair oil. So for that, the Malatyadi or Durdura Patradi is found to be very effective, and the Dharanaka Taila, which is also available at the market, is also very effective. And after that, when the Dharanaka is come down, then we can apply the Prabondarigadi or Gobatmajadi Kera or Nilibringadi Kera or the Kundala Gandhi. A lot of medicines are available in the market. So accordingly, so I think it is not necessary to continue the single oil throughout the life. Just as per the purpose, we can change the oil.
Thank you, sir. The next question is from Dr. Anju. Sir, can you please explain the effect of Jaluka Pavacharana in alopecia areata?
So that we have discussed as a general Samprapti, Acharya mentioned the Kushtaroga Samprapti. So as we are moving towards the scalp disease, it is a skin disease. So as a general, the Rakta Moksha is indicated. And in the Indralupta, just that we have discussed, the hair fall is due to Vata Kopa, and the new hair is prevented from coming out by the Kapha dosha. So the Kapha dosha should be managed so that the hair follicle should be stimulated by the Kuttana procedure. So the Rakta Moksha, the Kuttana or Prachana, or in some cases the Lekhana also is found to be very effective in the Indralupta cases. And in Jaluga, Jaluga is actually advised in Arungshika. Arungshika means it is somewhat inflammatory condition. That means acne necrotica miliaris. That means it is the Pitta Rakta Kopa condition. That is scalp skin inflammation. So scalp skin inflammation means we can easily remove the inflammatory product by the help of Jaluga. That means the Rakta Shodhana can be easily attained by the Jaluga. Whereas the Indralupta is concerned, it is not an inflammatory condition. In that condition, Jaluga, instead of Jaluga, the Kuttana or Prachana or Lekhana should be more effective.
Thank you, sir. The next question is from Dr. Sridevi. So how to do Vata Pitta Shamana for hair without causing Kabha Vriddhi and affecting eye health?
Actually, this Vata Pitta, as we have discussed, Shira is a Kaphasthana, but Vata Pitta Kopa is happening as per the correct reference from Susruta or Ashtanga Hridaya, Shoga, Srama, Krodha Kridaha, Shariroshma, Shirogata. So the Samprapti happening due to the accumulation of Pitta in the scalp from the entire body. So it is happening in the scalp from the entire body. So as an approach of Samprapti Vikatana, the entire body should be considered. So the Snehabana is the first. Snehabana followed by the Virejana should be the first line of approach to reduce the Vata Pitta Kopa in the scalp. So the for the Snehabana, we can select the drugs from the Kushtaroga Chigilsa, that means Aragota Mahatiktaka or Tiktaka or Gugulu Tiktaka, anything that we can take as a Snehabana and then do the Virejana. By that, we are reversing the Samprapti, that is Samprapti Vikatana, so that the Sharira Oshma will not accumulate in the hair, so that will be reduced into the Sostana. Sthana means it is the Pakashaya, is the sthana of Pitta. So it will be concentrating in that condition. So when the Samprapti Kopas to Unmarga Gamito, so the Pitta Kopa which is happening, so that we have explained in the Pathya, that means reduce the intake of spicy items, reduce the alcohol intake, reduce the smoking, or reduce the vinegar, like that materials we should be avoided. So that intake will cause the Pitta Kopa in the entire body, and that is going to be affected to the scalp. That is due to the predisposing factors like a genetic or due to some chemical application in the scalp, that will be going to be suddenly manifested. So to reduce the Vata Pitta Kopa in the scalp, our method to reduce the Vata Pitta Kopa from the entire body, and after that just give the local therapy as the Snehana from the in the form of any Taila, or in the form of Shamana Snehabana, or in the form of nasya. In the nasya also, the brahmana nasya or shamana nasya. Then shamana nasya is indicated kesha dosha akshirajishu. Kesha dosha shamana nasya is indicated. So we can go for the shamana nasya and local application of the hair oils, that is murtha taila, and the it should be first approached with the snehapana and virejana from the systemic pattern.
Thank you, sir. The next question is from Dr. Rekha. Sir, is there any special time to take hair bath? Whether we should not take it in afternoon time, and how many days should we oil the hair?
Actually, just the Brahme Muhurte Uttishtet Sosto Rakshartham Ayushaha Acharya starts the Dinacharya and Sharira Chintam Nirvritya Krita Shaucha Vidistada. And Acharya clearly just think about your health and go for the and Acharya clearly mentioned the time of bath is mentioned and the importance of Shiro Abhyanga is mentioned. Means Khalati, Palita, everything, and Indriya will be Prasadana will be happened by the Shiro Abhyanga like that. The morning time is the apt time or for taking bath, and if we are doing in the night, then it is somewhat danger because it will cause the accumulation of moisture in the scalp area. As we know, the scalp is having thick hairs and rich sebaceous glands and sweat glands. It will start somewhat fungal infection may happen in the scalp. So that fungal infection may lead to hair loss or some sort of the dandruff formation will happen. So in the morning time is the apt time to take bath. So what is the next question asked?
About oiling, sir. Like how many days in a week?
Oil in the head. Oil in the head, that is totally dependent upon the Prakriti. So if a patient is of Pitta Prakriti, then continuous application of the oil that we can be suggested. But if a patient is having a Kapha Prakriti, then the skin will be a moist skin or oily skin. In that condition, no need to go for a continuous hair oil or Murtha Taila or Shiro Abhyanga. Meanwhile, we have to Kora dosha tranaksharavadi, means we have to reduce the oil accumulation by just the cleaning that area with some the kshara prayoga. The kshara prayoga means it is not clearly indicated. It is only indicated when there is a huge accumulation of the dead skin and the sebaceous secretion is there, then no need to apply the oil daily. But daily application of oil is clearly indicated in the Pitta Prakriti. And Pitta Prakriti means the anxiety will be more. So the anxiety will be more, stress is more, sleeplessness is there. So by the application of a proper hair oil or Murtha Taila, just we are treating the stress also. So select the proper Shiro Abhyanga Taila to manage the hair fall as well as to manage the psychological factor and the Prakriti.
Thank you, sir. Next question. So what all Shamana Aushadhis can we think of in case of Kalitya?
What all Shamana Aushadhi?
Shamana Aushadhis we can think of in Kalityam.
Shamana Aushadhi means in Kalitya means as we have discussed, it has a similar samprapti as that of Indralupta. So the Shamana Aushadhi in the systemic or the oral intake is not at all sufficient to manage that condition. For that, the first treatment adopted or mentioned by Acharya Susruta or Acharya Vagbhata is the Vamana or Rekta Moksha or Prachana or Kutana. All these are the local application. So with only the Shamana medicine, we cannot do or we cannot manage that condition. So first promote the hair growth, and after coming the hairs, then we can give the medicines. So first in all the conditions we are thinking about the improper diet and the rasa rakta dusha as a systemic approach. So if there is a rasa rakta both having an ama condition that happens. So in this condition, we have to start with the Agni Dibana medicine. The Agni Dibana medicine, we should be followed by the Snehapana, and proper Vamana is indicated in that condition. So the proper Vamana is happened, then we have to think about the Tikshna Nasya and then go for the local therapy, Prachana or Lekhana or Kuttana. And after when the hair start coming out, then give the Rasayana Prayoga. I think that will be more appropriate.
Thank you, sir. So we are moving on to the last questions. So can you suggest an hair oil for daily use if there is no pathology of scalp? Something basic that we can prepare at home. And
So
what
for
all
that,
care should we, sorry, sir. And what all care should we give when we are preparing an oil at home?
Okay, when we are preparing the oil at home, then the oil, actually the oil that we are purchasing from the market, so there may be the adulterations will be there. So first go for the Taila Murchana. Murchana is very essential. Otherwise, if we are not doing the Murchana with the proper care, that will going to create ama. That means after applying that oil, the patient will start sneezing. So that will be very difficult. So go for a Taila Murchana first. So in the Taila Murchana means when we are applying the oil in the head, then that will start somewhat smell from the hair. So everyone is pleasant with a good smell in the hairs. So while we are doing the Murchana Samskara, then add the Gandha Dravya. That means the smelling agents are actually prescribed in the Murchana Samskara. So that will we will remove the amadosha, as well as it will give good fragrance to that oil. So after that, it is better to add the triphala. Triphala means, as we know, the all of the indriya are situated in the head. So the indriya should be properly maintained or properly cared while we are doing the Shiro Abhyanga or Shiro Taila. So otherwise it will start, just we have discussed, in some patients there will be ear discharge, in some patients there will be neck pain, in some patients there will be sneezing or some blurring of eyes or watering from the eyes. Everything that can happen if the oil is not apt. So first do the Murchana Samskara with the Gandha Dravya, just like the Naga Kesara or Ela, like that drugs are mentioned. So first prepare a very good fragrant oil and then add the Triphala Kalka. It is only necessary if there is no other pathology, then Triphala Murchida Taila is essential. Either in market is a Triphaladi Kera is available. And if we are planning for a good hair growth, then we can add Bringaraja in that. So Bringaraja and Triphala should be made into a Kalka form and prepare the Triphala Kashaya, and in that Kashaya add the Kalka and Taila, then go for the Snehapana Vidhi by the proper classical method. So it is essential to go for the or do the Taila Murchana with the fragrant drugs before preparing the Taila for head.
Thank you, sir. This question is followed by another question by Dr. Rekha. Sir, is whether dandruff contagious and can we completely cure dandruff?
Yes, as we have discussed, dandruff, it is a Kshudra, means actually Acharya Susruta is mentioned that this is a Kshudra Roga. Don't worry, it is never going to create more and more problems. So the dandruff is completely curable, but one thing should be taken into account, that the dandruff can happen as a part of psoriasis. So the psoriasis means if it is happening all over the body, then it is very difficult. It means if the psoriasis is happening in the body, then it will be maximum in the head, because the hair follicles, number of hair follicles and sebaceous glands are more in the scalp, so it will be there. So if it is not at all associated with any other systemic diseases, then it is completely curable. So the main approach is to remove the dead scales from the scalp and give a further manage the dryness of the scalp. So I think it is better to cut short the length of the hairs and wash the area thoroughly, and then it is better to start the local treatment. And if it is a patient is having a chronic, then Acharya clearly mentioned that Ashanto Vamana is clearly indicated. Do the Snehapana, then Vamana, and then clean the local area, and then give the Murtha or Shiro Abhyanga Taila properly, and just follow the case. The follow-up is more important, so that if the patient is a driver or riding the two-wheeler for a long time and wearing the helmet, then all these are going to create the problems once again. So when it is completely cured, then we have to observe the patient and restrict the patient from few vihara, so that the recurrence can be prevented.
Thank you so much, sir. So I think we'll wind up the session for today, and if there are more doubts, we'll get back to you on the next class.
Hello, ma'am. There was one last question, sir. If you could ask sir about it.
You can ask the question directly.
Sir, in the shlok that you mentioned, sir, that about the oil preparation, Padmaka and all, the Kunjalikam is what drug we should take for that?
Padmakinchalkam, is it?
Yeah.
Padmakinchalkam means it is a lotus. It is the lotus flower, and a lotus petals can be used.
Okay, so it's raw.
I think this Murchana Samskara is clearly mentioned in the Vaishyaja Ratnavali. A lot of drugs are mentioned. So from that, which are applicable or which are going to create a good smell in the oil, that can be selected. So Padmakinchalkam, it is a very good, and in the Murtha Levana Yoga, I think that yoga that we have again discussed here, Tila Malagadi Yoga, Tila Malaga Padmakinchalkam. So that is again good for the hairs.
Okay, sir. So this has to be like it in the raw form only we'll get, no? We have to use it.
Yes. In the raw form also we can use it. Means in the Murchana Samskara means it is just the preparation of the Taila for the main preparation. So we can use the medicine in the form of Kalka also. No problem.
Okay. And so Krishna Til, you have said that internally to give for how many days like we need to give it like? Which one? Krishna Til.
Krishna Tila. Okay. The Krishna Tila Rasayana, actually it is mentioned in the Vatatapika Rasayana of Ashtanga Hridaya. It is very good for hairs as well as for the teeth. So that means the Krishna Tila, it is one of the ingredients in the Gandha Taila. Gandha Taila, which is mentioned in the management of the fractures. That means the Krishna Tila has a strong affinity towards the Astidhadu. That is that property that we are using in the management of this hair related issues. For that we are usually, means there is some more indication is contraindication is there. I think you maybe know that if the patient is having some menstrual disorder, the Krishna Tila is going to promote the menstruation. That means Tila, that is Tiladi Koda.
In Atyartha, we should not.
Yes, it is mentioned. So if while we are giving for a long-term use, this should be considered. So the Krishna Tila should be given in milk as a daily routine practice that we can give as an Anupana. Usually, if we are giving the Brahma Rasayana or Chavana Prasha or the Narasimha Rasayana or Ajamamsa Rasayana, that can be given as a supplement. The Krishna Tila, processed kshira should be taken as an Anupana of the Rasayana. Otherwise, we can take or we can continuously give. This is for 45 days. No need to continue that. Otherwise, we have to take some break.
Okay. And sir, like you have to use it directly or you have to roast it and use it?
No need to roast, because the tila, Krishna tila, that tila is going to be acted.
Okay.
So
Okay.
in the preparation of the Gandha Taila, means in some cases in the OPD, that we are giving the Gandha Taila also as for oral use. That is
Yeah.
in the form of drops, 10 drops of
Yeah.
Gandha Taila. So the Gandha Taila is also having a good content of the Krishna Tila. So
Okay.
don't try to roast. Take the raw material, just wash it, and if needed, just make the free from the moisture and just crush it and give it in the milk.
Okay, fine, sir. Thank you. It was a very nice lecture, sir. Thank you.
Hello, sir. I
Hello.
hope it's fine. We have one more last question from Dr. Sridevi. Sir, could
Okay.
you please share the time duration of the Murchana procedure?
Murchana procedure means actually it is a procedure which is mentioned in the Bhaishya Ratnavali. It is not time related. So when actually while we are doing the Murchana, because the oil that we are getting having some moisture content, definitely there will be moisture content as an adulterant or as a part of the natural preparation of the oil. There may be the moisture content. So our aim is to reduce or to completely get rid of the moisture content. So just adding this dravya, and when we are doing the murchana, there will be some froth formation will be there, and after that it will be normally coming to the normal condition. So I think it is not a duration limited, but it is just the observe the taila, and after the I think a lot of observation method is also mentioned in the Bhaishya Ratnavali and in the Bhaishya Kalpana text. So by that we can do the murchana. Our aim of doing this murchana to get rid of the moisture content and make the oil very much fragrant, and it will be very much soothing to the head.
Thank you, sir. Sir, can we use Shida Jala also as Anupana for Krishna Tila?
Yes. Actually, in Rasayana Prakarana, it is the Krishna Tila Prakuncham. One Prakuncha of Krishna Tila should be taken in Shida Jala. Actually, it is given, either should be given, not in hot water. It's either it should be given in Shida Jala or in Kshira, because we are mainly concentrating on the Pitta or the Rasayana Guna that we are most appreciating by this Rasayana. So either in Shida Jala or in the Kshira that we can be, it can be advised.
Thank you so much, sir, for sharing your insights with us today. It was an information-packed session, and the way that you carefully explained each doubt from the smallest to the most complicated question shows your dedication as a teacher. And thank you so much for being there with us today. We're looking forward to your next session. So we'll discuss more interesting topics then. On behalf of Team CAME, I extend my heartfelt gratitude to you, sir. Thank you so much. And thank you to all the participants. Have a good night.
Good night.